Right, hello everybody. This is Isaac Amoa. I'll be doing this presentation on Ghana, the healthcare policy in Ghana. As you may know, Ghana is near and dear to my heart because I was born and raised there. So it makes sense that I will cover this assignment based on Ghana. So healthcare policy in Ghana. So before 2003, there was a system in Ghana called cash and carry. It's like a fee for service, so you have to pay upfront in order to get service, even if it's emergency. So imagine if you had an accident, you are bleeding to death, and they take you to the hospital, they demand you pay before you get seen. So if your friends and family are not there on time, you might lose your life. And a lot of people died. Some of my family died because of the cash and carry. So in 2003, the government brought a system called the National Health Insurance Scheme, which made healthcare universal to everybody, and you didn't have to pay upfront to get seen. So you shouldn't even have any cash on you. Just go, you show your ID card, and you get seen. So people were asking, how is the government going to fund this? So, and what is going to be covered under this scheme? So let me talk about the coverage. So it's a universal coverage, and it's the first of its kind in Africa. So what the government did is they did a survey and found that most of the diseases affecting the people of Ghana, and they covered all these diseases. Even some cancers are covered, like cervical cancer and breast cancer is what the kind of cancer that affects women in Ghana most. So these are covered under this insurance scheme. But not everything is covered, like plastic surgery is not covered, which you might agree. Any cosmetic surgery, if it's not to repair a disease condition or accident, it's not going to be covered. But any basic diseases affecting the people are covered. And the poor and the rich, they all have the same coverage. It's universal, just like Canada. So you get the same care. And people less than 18 years old, they don't have to pay any premium. And people over 60 years old and people that contribute to the Social Security and National Insurance Trust don't pay any premium. So talking about premium, that would lead me to the cost. So what is the cost of care? How much do people pay for care in Ghana? The answer is absolute zero or close to zero. I will explain that further. So close to zero, because if you are in the formal sector, that is, if you work a government job, or you work for the government, or you get a monthly pay through the payroll system, you get taxed for Social Security Insurance Trust, and 2.5% of that goes to this National Health Insurance Fund. And every tax that we get in the country is based off of value added tax, the VAT system, and 2.5% of this goes also towards the National Health Insurance Scheme. That's how this is funded. So under this, we have three forms of insurance. So we have the district insurance, we have the private, and we have the community mutual. So all these three help give people the insurance they need in Ghana. So under the district, that's usually based in all the rural areas as well. And the private are very common in the urban areas because most of these companies and organizations buy them for their employees. So we go to choice. So like, do you have choice in choosing your provider? The answer is yes. You can choose your provider and get seen, provided that provider is licensed under the health insurance scheme. Then the talk of quality. How is the quality like? I would say the quality is great because all the hospitals that are included in the network are also being monitored by the government. So quality is also good. But the only downside is there is wait time, longer waiting time, because they made the universal coverage. There was a lot of pressure on the healthcare system. There was a lot of pressure on these hospitals, and now they have to take all this influx of patients. So it put a lot of pressure on the healthcare system, and it made waiting list very longer. But all in all, Ghana's universal healthcare system is great, and like Canada, is like a single payer system. The downside to it is the longer wait time. But what is important is the poor and the uneducated people are being taken care of by the taxes paid by the educated and the rich. And I think that's great. And very soon Ghana will achieve 100% coverage, because now it's like 2/3 of the country is registered under this national health insurance scheme. And it's a great thing. Let me know if you have any questions. I'll post them in the comment, and I'll respond to you. Thank you.